if the passport for the vast majority of people, except for some people in the street, for the vast majority of people, the vaccination passport was very popular and gave them a great feeling of security when they were going to the restaurant or the movies. So why, I know we're at 85% vaccination, but if there's still a threat in the future, why are you eliminating it?
Okay, well, I'll start because this is really a recommendation of public health. But I think the conditions, as Dr. Boileau has done, has changed. And I said in my statement, we recognize that people were really feeling confident at the time when we have Delta as opposed to Omicron. They were feeling safe when they knew they can go to a restaurant or to a public place because that was protecting them. But the thing that's changed with Omicron, and I'll let Dr. Boileau complete that answer.
And in fact, they were feeling safer, and they were safer because with the vaccine, the contagiosity of Delta virus or the others that were before, but namely Delta, because we were in the last autumn period, it was very effective for that. But with the Omicron, which is a different virus, it's really different, more contagious. So the capacity of the double vaccine to protect for the contagiosity is really lowered. With 3 doses, it's quite good, but it's really lowered with 2 doses. So, and in fact, right now, we cannot move on with a standardized passport vaccine with 3 doses because a lot of Quebecers, at least 2 million, maybe 2.5 or 3 million, has made the infection recently. So we suggest them to wait until 8 to 12 weeks before being up to date with the 3rd doses. So it was not applicable. And that by that time, at the end of April, May, or even after, this wave should be behind us.
There are people that will accuse you of doing this because of the protests. Are you caving into public pressure from the street?
No, not at all. I think we're doing it because it's the right time to do it, because it's safe for public health. And as I said, I was very clear. It is there to last. When we'll need it, we will ask to be reestablished. Right now, the conditions are good, and I think this is the appropriate thing to do right now.
Raquel Fletcher, Global.
Good afternoon. Last week, we had the public health director say that the passport was going to stay in place until at least March 14th. On Friday, Mr. Dubé, during the interpellation, you said, well, we'll make an announcement to that effect in a couple weeks. It has not been a couple weeks. It has been a couple days. And now we're asking questions here about other things, about what's going to happen in the future. Is the mask going to stay in place? Is there a plan for a 4th dose? You gave us answers, but why should we believe what those answers are? Because the way that you are giving us this information changes so rapidly from day to day. I think that the opposition parties today are, their criticism this morning was not what the decisions are that you're making them, but how you're making those decisions. Is this the best way to be making those decisions?
Well, let's be clear. We said that this passport is there to stay when we need it. I'm just going to be very clear. You want to go to Europe this summer, you'll have countries, they will be requiring this passport, either at this duty here or there. So the passport is there to stay in certain circumstances. And when I said that, in the same week, remember, I said there could be a 6th wave. And remember, I said that in the same sentence. So let's be clear. Right now, we should be happy that we are able to withdraw the passport because it means it's going well. It's going better than a month ago. And it's like wedding might be going better even in a month from now. So let's take the joy of the news we're getting today. The conditions are improving, and if we can limit the measure and it's safe to do it, I think that's good news.
Okay, I'm not sure you answered my question, but I have to move on to a second topic. Doulas. Do you know what a doula is? Someone who helps a woman give birth.
Yeah.
They are asking to be allowed back in birthing centers and hospitals as a second support person, because right now the women giving birth are only allowed maybe their partner, their boyfriend, or their husband. They would also like to be allowed to have a doula. That is not being allowed at this point. When can we expect for doulas to be allowed back in the birthing room?
I'm not sure if I can answer that today. I'll have to check into this one. I'm not sure if I can give you the answer on that one.
Cathy Sonnet, CBC.
I just would like to clarify, that's my first question. What's the clear scientific evidence that the vaccine passport was efficient to protect the unvaccinated and the hospital network?
I'm sorry, I missed the question.
What's your clear evidence, Dr. Boileau, that the vaccine passport was actually efficient to protect the unvaccinated and the hospital network?
During the Omicron period, or?
Overall, like we're trying to find a clear evidence that the vaccine passport was actually efficient, that it made a difference. So do you have a clear evidence?
Yes, absolutely. We have clear evidence here in Quebec because it has higher the level of vaccinated people before right after the announcement and then after with the implementation of the vaccine, the vaccine passport. So this has been done and really obviously clarified in Quebec as in other jurisdictions. Right now in the Omicron situation, obviously it seems that without a passport, you were not able to get to restaurant and large surface stores. So it lowered the level of contact for those people that were not already vaccinated. So it lowered the risk for them to get infected and to increase the number of beds needed. So right now with those numbers of beds that are lower than they were, there's kind of acceptability to increase the risk of those persons to get infected, unfortunately, because they are going to be infected. If they are not already, they are going to be.
And what was the game changer in the last few days?
It was essentially the indicators of the beds, of the positivity of the test, of the other indicators that we have at school for health workers. So all those are going in the same way, lowering the significance of the risk globally for the population, but not enough to get rid of all the measures, but strong enough to begin to get rid of those, some like the vaccine passport for those places.
Minister Dubé, a lot of people are asking why we even did this if we're taking it away now. What's your answer to that? Why did we do the vaccine passport?
Well, because it has been very helpful, quite helpful. It has allowed Quebecers that were vaccinated last fall, to get back to a normal life. And now that we have Omicron and people that have been contaminated, we have a different ballgame. But I think we need to look back and say this was really appropriate for a part of the pandemic. And if we need to reinstate it, we'll reinstate it. But right now, that's the best thing that we can do, is to give away those measures as much as possible, because we can do it. That's the point.
Merci beaucoup.
Merci tout le monde. Merci beaucoup.
Conférence de presse.
Merci.